What is arthritis? Arthritis is the swelling and tenderness of one or more joints. It is one of the most common chronic diseases worldwide, affecting millions of people. While the symptoms, pain, stiffness, and swelling are well known, understanding the underlying pathophysiology of arthritis provides insight into its progression and management. Types of arthritis. Arthritis is not a disease affecting a single joint but a group of over 100 conditions. The two most common forms of arthritis are osteoarthritis and rheumatoid arthritis. Each has its pathophysiological mechanism and causes. Osteoarthritis, also known as degenerative joint disease. Osteoarthritis, osteo means bone, arthur means joint, and itis means inflammation, is the most common form of arthritis characterized by the breakdown of articular cartilage, the connective tissue between bones that reduces friction and prevents them from rubbing each other. Cartilage is primarily made of type 2 collagen and proteoglycans, which provide resilience and strength. In osteoarthritis, enzymes such as matrix metalloproteinases or MMPs degrade these components, weakening the cartilage. Over time, cartilage loss leads to direct bone-on-bone contact, causing pain and stiffness. One of the main problems in osteoarthritis is the progressive loss of articular cartilage. This means there's not much separating the two bones anymore, which causes significant friction between them. This friction generates inflammation and triggers pain through the joint. Risk factors for osteoarthritis, or OA, include age, obesity, sex, and joint injuries. The risk of developing OA increases with age. Age is the single most significant risk factor for developing osteoarthritis, meaning the risk of developing osteoarthritis increases significantly as we age. It's often referred to as a wear and tear disease associated with aging joints. Excess weight can increase pressure on the joints and increase the risk of developing OA, especially in weight-bearing joints like the hips or knees. Osteoarthritis is more common in women than men, especially after menopause when the estrogen level goes down. Injuries, such as those that occur when playing sports or from an accident which bring lots of inflammation, can increase the risk of OA. Osteoarthritis is common, and nearly everyone knows someone who suffers from it. People with osteoarthritis often feel stiffness in the morning, which usually lasts less than 1 hour, but comes back at the end of the day. Other risk factors include neurologic disorders, genetic factors, and even certain medications, and other mechanisms play a role in developing OA as well. Rheumatoid arthritis, or RA, is an autoimmune joint disease. Rheumatoid arthritis is a chronic autoimmune inflammatory disorder that mostly affects the joints, and it is triggered by an interaction between genetic and environmental factors. For example, if you have a certain gene like HLA-DR1 and HLA-DR4, you might develop rheumatoid arthritis after getting exposed to the environment, like cigarette smoke or a specific pathogen like bacteria or viruses. These environmental factors can cause modification of our antigens, such as IgG antibodies, or other proteins like collagen and vimentin, which get modified through a process called citrullination. This process causes the amino acid arginine found in the protein to be converted to citrulline, which is another amino acid. Because of this citrullination, our immune cells no longer recognize these proteins as self-proteins or our own proteins and start attacking them. This process starts activating T cells and B cells. B cells differentiate into plasma cells and start producing specific autoantibodies against these self-antigens, or our own proteins. These T cells and antibodies enter the circulation and reach the joint, which causes many inflammatory cells to migrate toward the joint, causing inflammation. Over time, this inflammation causes damage to the cartilage and other tissue and erodes the bone. With no protective cartilage between bones, the underlying bones are exposed to each other and directly rub against one another. IgM antibodies enter the joint and target altered IgG antibodies, and another antibody called anti-cyclic citrullinated peptide antibody, or CCP, enters the joint and targets citrullinated proteins. All these inflammatory processes form an immune complex and accumulate in the joint. These accumulations activate the complement system to promote more joint inflammation and injury. As the disease progresses, multiple joints on both sides of the body get inflamed, unlike osteoarthritis, which mostly involves one side of the body. Rheumatoid arthritis mostly involves multiple joints symmetrically, meaning the same joint groups on both sides of the body, like both sides of the hands, for instance. Mostly affected joints are the small joints like the metacarpophalangeal and proximal interphalangeal joints of the hands and the metatarsophalangeal joints of the feet. Over time, as the disease progresses, it can start to affect large joints like the shoulders, elbows, knees, and ankles. When the disease worsens, the affected joints get swollen, warm, red, and painful. As the disease progresses, they become stiff, especially in the morning or after being inactive for a prolonged period, and it gets better as they become active. People with rheumatoid arthritis mostly develop deformities in the hand, usually of the metacarpophalangeal joints in the hand, such as ulnar deviation of the fingers,